Take a look at this apical four-chamber view. What is this echogenic mass in the left atrium? At first glance, a tumor or a large thrombus comes to mind. But indeed, it is an extracardiac mass that is seen inside the left atrium. It is an excellent example of one of the most important ultrasound pitfalls. A slight thickness artifact or elevation beam width artifact is responsible for extracardiac structures appearing to be inside the heart. A two-dimensional echocardiography is not a zero-thickness plane. It has a finite thickness. In other words, the ultrasound beam is actually a thin three-dimensional slab. Therefore, structures which are outside the intended imaging plane can reflect some ultrasound waves. But interestingly, ecosystems display these structures inside the intended image, not beside it. Indeed, ultrasound system cannot determine whether these reflecting echoes originated from the center of the beam or from the edges. Now let's look at this patient's CT scan. There is a large esophageal tumor that we saw it inside the heart. Fortunately, the clue is simple. With a slight tilt or angulation of the probe, the apparent left atrial mass completely disappears. This view is from that patient with a slightly change in probe position. In fact, the mass is visible in only one imaging plane. Orthogonal views, 3D echocardiography, transesophageal echocardiography, CT scan, or cardiac MRI are helpful to confirm the artifact. So, never diagnose a cardiac mass from a single imaging plane. Here is echo views of another patient. Again, a large left atrial mass is demonstrated, while it is a mediastinal mass. Whenever an intracardiac mass suspected, multiple views should confirm it. A slight thickness artifact is not just interesting. It may lead to unnecessary investigations, inappropriate anticoagulation, or even surgery. The ultrasound beam is narrowest at the focal zone and becomes thicker both nearer and farther from it. So the artifacts are generally more when the region of interest is away from the focal zone. In conclusion, whenever an apparent intracardiac mass disappears with a slight probe angulation or cannot be reproduced in orthogonal planes, always consider slight thickness artifact before diagnosing thrombus or tumor.